Many people don't know this, but certain sleeping positions can increase the risk of pain, breathing difficulties, acid reflux, and even spinal problems, especially in older adults. There is one position that experts consider the most dangerous for this age group, and in this video I'll explain why it should be avoided and what the best alternatives are to ensure a safer and more comfortable night's sleep. Stay until the end to understand the risks and learn how simple changes in sleeping posture can improve sleep quality for the elderly. If you're new to the channel, be sure to like this video and subscribe so you don't miss any content. The position in which a person sleeps can have a significant impact on their health, especially in old age, when the body becomes more sensitive to pressure and discomfort. Sleeping on your stomach or in the prone position is considered one of the riskiest for seniors, and that's not by chance. This position can compromise breathing, cause muscle pain, harm the spine, and worsen several chronic conditions common in later life. Stomach sleeping can pose a serious risk to the breathing of elderly individuals. As we age, the respiratory system naturally changes. The lungs lose elasticity, the muscles involved in breathing weaken, and lung capacity decreases. When an older adult sleeps on their stomach, the body's weight presses on the chest and abdomen, making it harder for the lungs to expand and limiting airflow. This leads to shallower breathing, reducing the amount of oxygen that reaches the body during sleep. For those who already suffer from respiratory conditions such as asthma, bronchitis, or COPD, chronic obstructive pulmonary disease, the impact can be even more severe. The prone position also encourages partial obstruction of the upper airways, especially because the face is turned to the side and often pressed against the pillow. This obstruction can lead to snoring, feelings of suffocation, and even episodes of sleep apnea, where breathing stops for several seconds multiple times during the night. Apnea is a dangerous condition as it not only disrupts rest but also increases the risk of hypertension, heart arrhythmias, and strokes. Another key point is that poor breathing during sleep means the brain receives less oxygen. In elderly individuals, this oxygen reduction can accelerate cognitive decline, affect memory, reduce concentration, and increase the risk of daytime falls. That's why rethinking sleeping position is essential. Efficient breathing during sleep is critical for senior health, and the prone position significantly compromises this process. Sleeping on the stomach may feel comfortable to some, but for older adults, it places excessive strain on the neck and cervical spine. In this position, the head must be turned to one side for hours just to breathe. This prolonged neck rotation is neither natural nor healthy, especially for those who already have joint degeneration, muscle stiffness, or a history of neck pain, all common in older adults. Constant neck twisting in this position can compress nerves and blood vessels in the cervical area, leading to symptoms like pain, tingling in the arms, morning stiffness, and even dizziness. Additionally, the neck muscles remain in continuous tension, which can cause spasms, inflammation, and persistent discomfort. For seniors who already have reduced muscle elasticity and more sensitive joints, this overload can trigger pain episodes that last for days and interfere with basic daily activities like turning the head, getting dressed, or even safely getting out of bed. Another concern is that stomach sleeping distorts the natural curvature of the cervical spine. Instead of remaining in a neutral, aligned position, the neck is forced into an asymmetrical and unnatural posture, contributing to joint wear and potentially accelerating conditions like herniated discs or cervical osteoarthritis. Besides the neck, this poor posture also affects the shoulders, which are compressed against the mattress, and the lower back, which may become excessively arched. Over time, these nightly microtraumas can evolve into chronic pain and movement limitations. It's common for older adults who sleep on their stomach to wake up with a heavy head, pain behind the eyes, or even tension headaches, all consequences of poor cervical alignment during sleep. Therefore, it's essential to rethink this habit and seek sleeping positions that respect the body's natural alignment. Sleeping on the side, with the neck well supported by a properly sized pillow, or even on the back, can help protect spinal health and promote safer, more restorative sleep. When a senior sleeps on their stomach, the spine is subjected to forced curvature, especially in the lumbar area. That's because in this position, the pelvis tends to sink into the mattress, causing the lower back to arch more than normal. This hyperextension, held for hours during sleep, strains muscles, ligaments, and spinal discs, resulting in discomfort and, over time, persistent pain. Other areas are also affected. The shoulders, for instance, are compressed against the bed, which can cause tendon inflammation and joint pain, especially in those with bursitis or tendinitis. The hips, which also bear direct pressure from body weight, can become more sensitive, particularly in seniors with arthritis or other degenerative conditions. In this position, the body cannot maintain proper alignment, causing joints to work unevenly and inefficiently, speeding up the deterioration of already weakened structures. Another important factor is that back muscles are forced to stay slightly contracted throughout the night to hold this position. This creates muscle tension, preventing full body relaxation. As a result, many seniors who sleep like this wake up feeling tired, stiff, and sore, especially in the back and shoulders. Over time, this pattern can lead to chronic pain, directly affecting quality of life, mobility, and even mood. That's why avoiding stomach sleeping is a simple but highly effective measure to prevent or ease back and joint pain in old age. Choosing positions that respect the body's natural curvature, like sleeping on the side with supportive pillows, can make a big difference in ensuring healthier, more restorative sleep. When an elderly person sleeps on their stomach, pressure on the abdomen increases. The body's weight compresses the stomach area, promoting the backflow of gastric acids into the esophagus. Since this region isn't prepared to handle such acidity, uncomfortable symptoms appear, like chest burning, heartburn, bitter taste in the mouth, and even a dry cough during the night. Often, the person doesn't realize they're experiencing reflux while sleeping, but wakes up with a sore throat, hoarseness, or frequent throat clearing, unaware that these are linked to their sleeping position. Beyond physical discomfort, nighttime reflux severely affects sleep quality. The body needs deep, uninterrupted sleep to perform essential recovery and regulation functions. When sleep is constantly interrupted by reflux, even if unconsciously, the body cannot rest properly. The result is persistent daytime fatigue, reduced energy, and in many cases, worsening digestive issues. Another risk factor is the frequent use of medications common among older adults. Many drugs, such as anti-inflammatories and certain muscle relaxants, can further weaken the esophageal sphincter or irritate the stomach lining, making the body more vulnerable to reflux effects, especially when lying in poor positions. For all these reasons, avoiding stomach sleeping is highly recommended, particularly for those with heartburn or indigestion. Sleeping on the side, preferably the left side, can help reduce reflux, since this position promotes gastric emptying and reduces pressure on the stomach. Small changes in sleeping posture can bring great relief to those dealing with this issue, improving both sleep quality and overall health. If an elderly person needs to get up at night to use the bathroom, for example, getting out of the prone position can require more effort and coordination than they have in a sleepy state. Often, they must strain their neck, shoulders, and lower back to turn over or sit up, which can be uncomfortable or even painful, especially with conditions like arthritis, back pain, or muscle weakness. This extra effort increases the risk of imbalance and falls, especially if they try to get up quickly or without proper support. Another concern is that after hours of sleeping on the stomach, joints may become stiff and there may be a mild loss of sensation in the arms or legs due to poor circulation or nerve compression. This makes it even harder for the elderly to move, especially upon waking. The lack of leg stability, combined with dizziness or disorientation common during the night, creates a high-risk scenario for falls. And we know that a fall in older people is no small matter. It can lead to fractures, hospitalizations, and a significant loss of independence. Stomach sleeping also prevents proper use of pillows or supports that help stabilize the body during the night. This leaves seniors more vulnerable to sudden movements or uncomfortable positions that worsen mobility and safety issues. That's why rethinking this sleeping position is so important. Prioritizing side sleeping with proper pillow support helps preserve mobility, makes nighttime movements easier, and significantly reduces the risk of falls, providing greater safety and quality of life in old age. The position we sleep in has a direct impact on spinal, joint, respiratory, and even digestive health. For seniors, this care becomes even more important since their bodies are more sensitive to pressure, imbalance, and postural changes. After age 60, issues such as lower back pain, sleep apnea, acid reflux, joint stiffness, and nighttime breathing difficulties become more common. That's why choosing a sleeping position that respects the body's anatomy and promotes muscle relaxation is crucial for ensuring healthier, more restorative rest. Among all possible positions, two stand out as the safest and most recommended for older adults: side sleeping and back sleeping, as long as the proper support is provided. The side position, or lateral decubitus, is widely considered one of the best for seniors. Sleeping on the side, especially with a pillow between the knees, helps keep the spine aligned and avoids twisting and strain on the lower back and neck. That small detail, a pillow between the legs, makes all the difference. It helps align the hips with the shoulders and spine, reduces joint stress, and prevents back pain upon waking. Moreover, this position allows the neck and back muscles to relax more naturally, decreasing muscle stiffness and contributing to deeper sleep. Another benefit of the side sleeping position is improved breathing. When a person lies on their side, especially on the left side, pressure on the upper airways is reduced. This helps prevent or alleviate episodes of sleep apnea, a condition characterized by temporary pauses in breathing during the night. Apnea is quite common among older adults and, if left untreated, can lead to serious complications such as high blood pressure, extreme fatigue, and heart problems. Sleeping on the side facilitates airflow and reduces airway collapse, making breathing more stable throughout the night. Additionally, this position is particularly advantageous for those who suffer from gastroesophageal reflux. Sleeping on the left side helps keep the stomach below the esophagus, which prevents stomach acid from flowing back into the esophagus during sleep. This happens due to gravity and the natural anatomy of the digestive organs. This simple change in position can significantly reduce episodes of heartburn, chest burning, and nighttime discomfort, all common symptoms among seniors with reflux. For those accustomed to sleeping on their stomach or in other positions that promote acid reflux, adopting the habit of side sleeping can lead to noticeable improvements in sleep quality and digestive health. It's important to note, however, that even in the side position, comfort depends on a few adjustments. The pillow used under the head should be of adequate height to keep the neck aligned with the rest of the spine. A pillow that is too high or too low can create tension in the neck and shoulders. Using a small pillow or cushion to support the arms can also be helpful, preventing numbness or nerve compression. The back sleeping position, also known as the supine position, is another safe and recommended option for many seniors, especially those who don't suffer from snoring or sleep apnea. When properly supported, this position allows for even distribution of body weight across the mattress, helping to reduce pressure points on the joints. With the spine well supported, there is less chance of twisting or muscle strain, particularly in the lower back and neck. For this position to be truly beneficial, it's important to use a pillow that keeps the head aligned with the torso, not too high and not too low. Additionally, placing a small pillow or bolster under the knees helps relieve pressure on the lower back, promoting a more natural spinal alignment. This knee support prevents excessive curvature of the lower back, which could otherwise cause pain upon waking. Back sleeping can be especially comfortable for those with shoulder pain, as the shoulders aren't being compressed against the mattress. It's also helpful for those with arthritis in the hip joints, as this position avoids prolonged compression of those areas. However, it's important to note, this position is not recommended for those who snore heavily or have diagnosed sleep apnea. When someone sleeps on their back, the base of the tongue and the soft palate can fall backward and partially block the airways, worsening these conditions. For individuals who don't have these issues, the supine position can offer a peaceful and pain-free night's sleep. It's worth emphasizing that the mattress plays a crucial role here. A firm mattress that can conform to the body's natural curves is ideal. It should support the body without sagging excessively, providing proper support for the spine, hips, and shoulders. Both the side and back positions can be adapted using specific pillows, body cushions, or ergonomic supports. What's most important is always seeking comfort and alignment while respecting each person's physical limitations and preferences. There's no single perfect sleeping position for everyone, but rather the one that offers the best balance between relaxation and support. For older adults, that means relieving muscle tension, making breathing easier, and avoiding the worsening of problems like reflux, apnea, or chronic pain. Beyond the choice of sleeping position, it's also worth remembering that the sleep environment influences sleep quality. A good quality mattress, a suitable pillow, a comfortable room temperature, and the absence of excessive light or noise all complement these postural care strategies. Sleeping well in old age is not just a comfort, it's a necessity. Quality sleep is directly linked to memory, immunity, mood, and energy for daily activities. Therefore, encouraging seniors to sleep on their side, with the right support between the knees and a pillow that properly supports the neck, or on their back, with support under the knees and the head well positioned, is an important step toward improving their overall health. Avoiding stomach sleeping and adopting sleep habits that respect the body may seem like a small detail, but it can bring significant long-term benefits. A good night's sleep starts with the right posture, and for the elderly, this can make all the difference between a morning of pain and a morning of well-being.